I've noticed that there are two types of people. One that just tell me what to do. Tell me what to eat. Tell me what exercise. I don't want to know why. I don't know. I don't even care if there's a scientific backing to what you're telling me. Just tell me what to do. Others, however, are saying, hey, why am I doing what you're asking me to do? Where's the science to support that what you're asking me to do is the right thing to do? Well, today I have the great pleasure of speaking with Dr. Stacy Kenfield, who is all about the science as it relates to lifestyle practices and prostate cancer. Dr. Kenfield is a professor of urology and epidemiology and biostatistics at the University of California, San Francisco, UCSF, and is the Helen Diller Family Chair in Population Science of Urologic Cancer and have been the faculty at UCSF since 2012. She is an epidemiologist by training and co-directs the Urological Clinical and Translational Science program in urology at UCSF. She has a master's and doctorate degree in the science of epidemiology from Harvard School of Public Health and has a behavioral science. As a behavioral scientist, she's also conducts diet and exercise interventions for cancer survivors. Lastly, she is the director of the Study Coordination Center for Large Global Study of Exercise for Men and Metastatic Prostate Cancer, funded by Movember Foundation, and has received grants from the National Institute of Health, the Prostate Cancer Foundation, also from the American Cancer Society. So we take a little bit of a deep dive into the application of her research. She's literally written hundreds of papers on lifestyle for over 20 years. I can tell you, as you will hear in this episode, that much of what I prescribe to patients is from her research. All I try to do is interpret her research and make it so it's applicable to you. Lastly, we definitely talk about the fact that lifestyle medicine is medicine and likely has anti-cancer properties. So it's not only, hey, do this lifestyle so you can feel better. No, it's what are the anti-cancer benefits of lifestyle practices, primarily, as we discussed with Dr. Kenfield, diet and exercise as it relates to prostate cancer, so that you, men with prostate cancer, can live better and thrive despite that diagnosis. Please enjoy this really amazing conversation with Dr. Stacy Kenfield on lifestyle medicine for prostate cancer. Let's go. Before I proceed, I just want to clarify that this podcast and all Dr. Geo content is separate from my faculty position at NYU Langone Health. The views and opinions on this podcast are my own. Our guests and sponsors are curated by me and not affiliated with NYU Langone Health. Sponsors are a way for us to provide high quality information at no cost to you so that you can take better charge of your prostate health, testosterone, and erectile function, and also how to live better with age. Welcome to the Dr. Geo Prostate Podcast. I am your host, Dr. Geo, where it is my intention to help you optimize your prostate health, help you live your best life despite prostate cancer, and in general, how to live better with age. Today's guest is Dr. Stacy Kenfield. Stacy, thank you so much for being on. Much of what I'm about to say now you've heard because we started talking before we started recording. And I met you at the American Urological Association meeting. You were walking one way, I was walking the other. And I say, there she is. Now, keep in mind that sometimes I even see celebrities in my office. And I don't really care. I'm not starstruck. Yes, I haven't seen maybe too many A celebrities, but B and B pluses. And I'm like, okay, come in, elbows on the table. I still need to check your prostate, man. Come on. I mean, you're just another person. Seeing Stacy Kenfield for me meant a whole lot more than any celebrity that has ever been to my office, because I've been following your work for so long and really read the literature, you're publishing papers carefully, interpret it in a way that, I can apply clinically. And I don't know of a person who's published more on lifestyle specifically to prostate cancer like you have. So it is a huge honor to have you on the podcast and to get to know you.
I'm so glad to be here. Thank you so much for inviting me.
Thank you. So is there any research that you published initially? I mean, you've been publishing quite a lot of in over 20 years. So is there any research as it relates to lifestyle element that you've published in the last close to 25 years that you published to about 23 years ago, let's say, and then it's not true anymore? Then other research say, well, you know what we published, I don't know. I'm exaggerating, right? But smoking is no, actually smoking is not that bad. In that, is there anything that you've published that was true initially and not so true anymore as it relates to prostate cancer?
Well, I think that what's consistent is exercise and not smoking. So those are the most consistent findings over time. In 2018, exercise was added as a benefit for men with prostate cancer to the National Exercise Guidelines for Americans, and because the data were so consistent. The dietary data are less consistent. There are fewer cohort studies across the world that have men with prostate cancer in them. And so dietary data is collected differently across different studies. So it's really hard to look at the exact same thing across studies and get the exact same answer. And then some of these factors have not been looked at in more than one study, right? So we're still waiting for other studies to be done to see if these results can track across studies and populations.
So when I'm asked by a group, when I'm giving a talk, well, how do you come up with these, because I do have protocols, right? So how do you come up with this? And then it leads to the next question. How do you interpret the studies, right, to make these conclusions? I said, well, that's a very good question. And of course, I'm a human being. I'm biased. I don't do surgery. But when people say, well, I went to Dr. So-and-so, he's a surgeon, he wants to do surgery. It's like, look, there's an inherent bias there. They truly believe that this is the best thing for you. And then they are the best at it. And if you're going to have surgery, you want somebody that has a little ego. It's like, I'm really good at this. Well, my thing is lifestyle, 1,000%. But even within lifestyle, there's a lot of nuances. So we spoke about earlier, exercise. I mean, exercise is, if there's the one thing in my practice, if there's the one thing that people can do to improve their longevity despite of the diagnosis of prostate cancer. And Stacey, I don't know if I'm going out on a limb, but based on research, more recent research that looked at people that did, hit like high intensity interval training and all these things, and literally regression of prostate cancer cells, at least in petri dishes, when they extract blood and they kind of place it in the cancer cells in the petri dish. I started lately being more bold and saying, well, this is beyond, yes, your quality of life improves. Yes, you lose some weight, potentially. Some level of calorie restriction is important there. But I think there's cancer regression. I think there's anti-cancer properties in exercise. My question to you, am I pushing the envelope a little bit? And I know scientists, how you guys work, you don't go out on a limb. You're the anti go out on a limb person, because if the studies don't say it, you don't say it. But I am, because I'm not a scientist. Am I exaggerating with that statement?
Well, the first study that we did, it was the first study done in men with prostate cancer back in 2011. We reported that vigorous activity was more beneficial than moderate activity. So these are things like running and tennis, racquetball, and jogging. Versus, a brisk walk. But there have been studies since then that have found that even less exercise is beneficial. For example, 20 minutes of biking per week or 20 minutes of walking per day. 20 minutes of walking or biking per day is beneficial for lowering your risk of prostate cancer specific mortality by about 39%. And so even light levels are good. If you can do anything, it's good. I think I recommend high intensity interval training for people that really don't have a lot of time to exercise, right? Because you can do the vigorous and activity in a much faster way and get a good workout in with less time. And I like doing that kind of exercise. So I would recommend that to a person who was interested in that type of exercise.
So I think you're gonna like this. The way I've broken down exercise, and I don't even think my audience knows because I actually had to think about it a little bit and kind of put it together so it makes sense. The way I broke down exercise is that the I hate exercise person, the I'm okay with exercise person, and I love exercise person, right?
Yeah.
Because
Yeah.
I just want them to succeed, and consistency is more important than intensity, right?
Oh,
You
yes. It
right?
has to
Just be
become a habit.
consistent. Yeah.
Yes.
So one thing, so then the person, so while okay, my bias is no, it needs to be prescriptive. You need certain amount of resistant training. You need a certain amount of blah 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 and blah blah blah. 15 years ago or so, 20 years ago, when I first started seeing patients, I gave patients like I don't know if you remember the program, the online program. It was a VCR, VHS. I don't know. I can't keep track of time and how technology changes. P90X, right?
Sure.
It's like do this program. Almost all of them came back to me and said, "Are you crazy? Are you trying to kill me? Like, what do you think I am?" I said, "This is a good program." You said, "No, there's no way I can do this." So I was horrible initially because it was more like I think I was unintentionally just shaming these people, like, "Oh, you guys are not disciplining enough." That's not it. It's my fault. It was my fault. It was my fault then, and I was able to figure out years later. But I said, "Well, maybe it's me." So then what we decided to do is, okay, so some people are just, I mean, imagine if you've been a studious, a cerebral person all of your life, nothing physical. And now I'm not saying do this intensity exercise. Man, if this guy gives me 150 minutes a week of just walking, that's a win, right?
Yeah.
The other guy with prostate cancer who was an ex-athlete in college and so forth, I could do a little more with him and maybe, be more prescriptive there. Even with the first guy, right? The geeky guy, the cerebral guy, I work him up, just give me 150 minutes a week of walking. And then maybe we can introduce like bands, rub those weight resistant bands and
Mhm.
so forth, little by little, and they gain results. I will tell you, Stacey, that my patients which is remarkable, on ADT, so androgen deprivation therapy, which typically they lose muscle and things, they gain a little muscle, not a
That's
lot,
great. Yeah.
but they actually gain a little muscle while they have no testosterone. So that's actually a clinical finding that's been fascinating. I think there's a large group, a lot of the Aussies write a lot, they write about exercise quite a bit in prostate cancer. So I think some of the research had demonstrated that as well. So speaking of exercise, what is the prescription? Let's just say you have a guy, he's willing to do anything. Whatever you tell me to do, I will absolutely do it. And some of these guys are actually very motivated, is another thing. They are super motivated. They'll do whatever you ask them to do. What would be the best prescription for a man, exercise prescription, after a diagnosis with prostate cancer?
Well, I can tell you that in my current study called Prostate 2, it's for men who have surgery, have a radical prostatectomy. They're in the study for 2 years. If they get randomized to the intervention arm, we tell them to aim for the guidelines. So go for at least 150 minutes of moderate to vigorous intensity exercise, aerobic exercise per week. We also tell them to aim for 2 days per week of resistance exercise. And for that, we tell them 8 to 10 exercises working major muscle groups, at least 2 sets, 2 days a week. And then balance exercises at least 2 days a week, balance and flexibility exercises.
Wow,
So if they can hit
that's a
that,
significant
that
amount.
would
Yeah.
be that would be what we should aim
And
for
so
every
how many men are in this study?
204 men were enrolled in the study.
So for 2 years, so do we have some outcomes from that?
We are publishing next June, hopefully, on that study. So
Is there
it's
anything
really
you can
exciting.
is there anything you can share with us before you publish in June of 2025?
I should not.
Oh no. Keep the suspense. This is, you see, everyone listening, I love my scientist colleagues. They are amazing. And outside of just their work, they're amazing people. But I tell you, it's hard to get good information or for them to give us a little something before the study's actually published. Is the outcome good and favorable?
Well, I mean, we have not looked at the outcome yet, right?
I
Because
see.
we are still waiting for the study to finish. But
I
we are
see.
going to look at changes over time, behavior changes over time. The outcome is PSA recurrence.
Yeah.
And we're also measuring the Decipher score
Yep.
in the tissue and seeing whether or not that changes over time, which has been linked to bad outcomes for prostate cancer.
Lovely.
So and we'll be also looking at sexual and urinary function as well and seeing if that is impacted with diet and
Lovely.
exercise. So
So
there's a lot.
recurrent. So the patients recruited Were they all at least intermediate risk and not low risk?
Well, so they had to be at the proper risk to actually get a radical prostatectomy. So not super low risk prostate
Got it.
cancer.
Got it. Some
Yeah.
intermediate risk and higher up. And so so how do you, what would you, so initially from the prostate sample, they give you a Decipher score. So how are you measuring a Decipher after that?
Yeah. So we are looking at the biopsy tissue
I see.
and measuring it in there. And we're also looking at the RP tissue and measuring Decipher in that. And we'll be looking at change over time between
I see.
the time they start, which is about 8 weeks prior to their surgery, and the tissue
Oh,
from their surgery.
so maybe
Because
there's a
yeah,
difference in the tissue from the time of the biopsy to the time of the surgery. Maybe,
yeah,
hopefully.
maybe. Yes.
There's 8 weeks, and that should say, give you some idea. Okay,
Yeah. Anyway, I
that's
hope to be on the
lovely.
show again and I can share
Oh
more.
my, are you? So we're talking June. All right, you'll be on the show again. Okay, let's put this study aside for a second. Assuming that you base that protocol, that exercise protocol, from other studies, is that what happened?
So in this study, it's all remote, which is kind
Mhm,
of great because people can live wherever they want to, and they get coaching.
mhm,
So they get a personalized report at baseline and 12 months and 24 months. And we tell them if they're meeting, almost meeting, or not meeting our recommendations for a variety of factors. The study was built on Prostate 8, which was a pilot study that we
mhm,
completed in 2019 and published in European Urology. And we're able to see that people did make changes in their diet,
mhm.
not their exercise. We had this crazy recommendation of 3 or more hours per week of vigorous, as you saw, exercise in your own clinic.
Yeah,
It's hard, right? It's really hard to meet that cutoff. And so we aimed slightly lower for the second study, where we're just asking people to meet the national recommendations for physical activity, which is that 150 minutes per week of moderate to vigorous intensity activity. So we'll see. We'll see how they do.
how do you measure intensity? So what does moderate to high intensity mean in your
Yeah, so we actually have them wear a polar heart rate monitor. They have a link to a portal, and that polar heart rate data goes to the portal. They can choose to see, like, they can set whatever goal they want. So we tell them to aim for 150 minutes. Maybe they only have time for 75 minutes per week. So that's great. It's something. And they can see their zones. So the polar heart rate monitor gives you zones. So we use zone 4 and 5 as vigorous intensity, and zones 2 and 3 as moderate
I see.
intensity activity.
Right. So, and that's measured by heart rate. So the higher the heart rate, the higher your zone.
Yes.
And do they stay in that zone consistently for X period of time? So for 20 minutes, they're in that zone 4 or whatever?
No, not necessarily, but you get minutes to the zone with every exercise session you do. So I may exercise for 30 minutes. I might get 8 minutes of vigorous, and that counts to my
Sure.
vigorous goal. Yep.
Sure. Because technically zone 5 is like really high intensity. It's almost
Yeah.
like a sprint. You're not going to sprint for 30 minutes.
No.
Oh, yeah. Yeah, that makes
Yeah.
sense. There might be some benefit for zone 2. There's a lot of research around zone 2, which is that zone 2 is that pace that you can actually have a conversation with someone else if someone
Yeah.
else was next to you. And it's like a boring pace, actually. Like you want to, it's almost like, so for me, zone 2 is a jog or a very fast walk where my elbows are swinging. It's
Yeah.
not really much running for me in my
No.
zone 2.
No.
And it's like, am I running? Am I walking? What am I doing? But that's my zone 2 at this moment in time, depending on where I am cardiovascular with my fitness. But so it could be that. So that's for the listener. Zone 2 is, you can have a conversation with someone else. The higher the intensity, your heart rate goes higher. And literally zone 5 is like you're going really fast. That's probably, you do a little bit of an intermittent type of training in that scenario. So I recommend 300 hours a week. And again, we depending on their baseline. Again, I want to set them up for success, and I don't want them to overwhelm them for them to say, you know what, I'm done with it. I'm not doing anything. I don't want them to say that. But most of my patients are actually, they seem to be very compliant and very willing to do it. Particularly when I recommend and when I say, look, by far, if nothing else, exercise often. The other thing I tell them, Stacy, based on other research, cardiovascular research that just came out, is stay moving. So even if let's say you give me an hour a day every day, let's just say, don't sit down for 12 hours. And I don't know what's the recurrence rate in that scenario, if at all. I don't know. But I know from a cardiovascular perspective, there's still higher cardiovascular risk in patients who, even if they exercise, if they sit down for the next 10 hours a day, there's still a higher risk. So stay moving. And I give them
Yeah.
all kinds of ideas of how to do that.
Right.
Any ideas around that in prostate cancer, even if it's not do you think there's something there from a recurrence perspective in that scenario where, again, they exercise every morning, let's say 7 days a week, but then they sit down for a long period of time? What do you think would be the result there?
Dr. Geo Prostate Podcast likes to bring you a fast fact about AG1 by Athletic Greens. AG1 is formulated with bioavailable ingredients that actually work with your body. Its powder form makes it easy to digest, so your body can access the nutrient-dense ingredients it needs. Try AG1 today and get a free 1-year supply of vitamin D3 plus K2 and 5 free travel packs with your first purchase. Click on the link and enjoy AG1.
We have not looked at that. I think fitness is probably more critical than your sedentary behavior. Just making sure that you get that regular exercise in, I think, is sufficient. But I think, there's no data to suggest that sedentary behavior so far is associated either way with prostate cancer clinical outcomes.
Right. Yeah, that's what I thought. Maybe that's another study that you look young enough that you'll be working for a while. So you have put that in your idea box, maybe. There's a recent study that just came out. I just wrote about it with relation to that in cardiovascular disease. And I thought it was more AFib, more cardiovascular disease of all kinds, and those that exercise, but remain sedentary for the rest of the day. So yeah, I go back. So I tell them 7 days a week. By the way, I focus on physical activity, all levels, low intensity, moderate. Low intensity is literally moving. So underneath my desk, I actually have a little treadmill. And sometimes I'm even on a little treadmill in a slow walk, So some kind of movement, low intensity, moderate intensity, high intensity. I ask them to be in moderate to high, about 150 minutes to 200 minutes a week, more or less. And then, but still a total of about 6 hours a week of movement of all kinds. So that's kind of
great goal,
right?
That is
because
then
then the next question is, so Dr. Geo, great. Do you do 7 days a week? I mean, you're asking me to do it. Do you do it? And I say, no, but I do live in New York City. So I live in New York, and I go to New York City quite a bit for work. And that's when I get my 13,000 steps in or something like that with some level of intensity, right? So I don't discount that and the intensity is low to moderate, somewhere in between. So I count that. I do other exercises. And so then if we include all of that, then that may count. But let's just say people don't live in cities. If you say 7 days a week and man, I had a rough week, you probably did 5. You probably exercise for 5. So that's pretty good. So any thoughts on anything that I've said, if I'm way off, that you think that, how can we tweak it better?
Yeah, I think a lot of our studies aim for 3 days a week, right? So if you're not doing any exercise, I think a good goal is 3 days a week, every other day, right?
Yeah.
Every other day.
Yeah.
I find it really helpful for myself to schedule it into my calendar that I'm going to exercise. Otherwise, meetings run long, things happen, right? And so if it's not in your calendar as an actual appointment, it's sometimes hard to make it happen. I also just plan activities with friends. So I'll plan to go hiking with a friend and I get my activity in that way. So it's really fun actually doing activities with friends because the time just goes by so much faster when you have somebody next to you than when you're doing it on your own. Yeah. So those are some of my tips.
That's actually a lot of fun. If you can do it with a friend or a community, I lift weights with a friend or my neighbor actually, and it just makes it so much better than doing it by myself. I don't mind doing it by myself, but when it's with him, we kind of talk, we catch up, we talk about whatever's going on in the world. All right, you go, do your set, I go do my set. And it just makes it, we know that engagement with people and community matters a lot for health, actually.
Yeah.
Awesome. All right, let's move along So cigarette smoking. So you've been very clear that, hey, this is actually an issue way beyond your lung health and emphysema and lung cancer. It's actually a big issue for prostate cancer. That's I mean, you could expand on that. And B, what's the mechanism you think? I mean, we know that arteries and become, more hardened, and it's not good for arteries. But what would you think is the mechanism that cigarette smoking increases the risk of, again, correct me if I'm wrong, prostate cancer risk, perhaps recurrence risk, and mortality after a diagnosis of prostate cancer?
I would think it's more of the carcinogens and causing DNA damage.
Mhm.
But there have been multiple studies now looking at this. We published a study in JAMA, probably I think it was in 2012 now, showing that current smokers had a 60% increased risk of dying of prostate cancer if you're a current smoker at diagnosis. So if you are diagnosed with prostate cancer, I would advise to quit as soon as possible and get the help you need to support that quitting, because it's hard to do this on your own. Take advantage of resources to help you quit. We know that a non-smoker and someone who's quit for 10 or more years has about a similar risk of prostate cancer specific death. So the faster you quit, the faster you can get to that place of 10 or more years of quitting. So and we know that, the dose matters as well. So if you can smoke less, if you can't quit right away, but you can reduce your amount of cigarettes per day, we recommend that to do that.
Do we know if you've been a lifelong smoker and you stopped, at the moment you were diagnosed, do we know if that makes a difference as it relates to prostate cancer, either progression or mortality? Or if they have been a lifelong smoker and then they get diagnosed with prostate cancer, it's like, okay, I'm already diagnosed with prostate cancer. Why would I stop now? Kind of thing. So is there benefit from that at that point?
Well, we know, most men don't die of their prostate cancer, right? Most men die with their prostate cancer, not of their prostate cancer,
point,
right?
yeah.
We care about chronic disease at this point, right?
Yeah.
The most other cause of death for men with prostate cancer is heart disease. We know that smoking is associated with heart disease. And so the benefits there's so many benefits to quitting smoking, not just for prostate, but for everything else, right? So
you're preaching to the choir. I agree. Yeah.
That is the motivation to quit. Even if you've been a lifelong smoker, not for your prostate cancer, but for every other disease that smoking causes.
You know what's interesting? That, I see many men weekly, and I'm very curious and observe their psychology of how they think of things. And I'm looking at myself. I was like, wait a minute, I am one of these guys, and am I as foolish as some of the guys that I see? And sometimes the answer is actually yes, unfortunately. So I try to make those changes. So very clear, this is the conversation with patients. Look, you don't want to die from a heart disease. I mean, it's still, heart attack is the number one killer in the world. Every 30 seconds, a man dies of a heart attack. They still focus on the C word. It's something about the PSA test and prostate cancer that it's still way more nerve-wracking than high triglycerides, high LDL, and the risk of a heart attack. I just can't wrap my brain around that.
Well, if you want to quit for prostate cancer, you should do so, because
exactly whatever
smoking is related to prostate cancer outcomes. So
that's right.
Yeah.
And as you mentioned before we started recording, when we were ranking, maybe the ranking, you'll say smoking first, actually, and exercise second. And if we have to rank, obviously you want to do it all. But, I just don't see a lot of people that smoke. But I think that, since this is a platform that many tens of thousands of people are listening and will be listening, I think is a very important reminder that the data shows it. Clinically, I see it. Smoking is just not a good thing for you. So stop, or even, as you said, the poison is in the dose, right? So reduce by, when I've had patients that smoke, they say, I smoke a pack a day. I said, well, let's start with half a pack then. And what makes you smoke? Well, after dinner. All right, so just only after dinner, right? Or after a meal. Can we do that? So kind of we work our way in.
Yeah.
But all right, everyone, stop smoking. Stop smoking if you're a smoker. All right, diet. Now that's a tough nut to crack, no pun intended. I mean, it seems like there's diet wars out there. It's almost like religion or political affiliations at this point. the paleo, the this, and everybody's trying to, and when they try to pull me in to see what side I'm in, I'm like, nope, I don't do that. I don't do sides. First of all, I've done almost every diet. I've read many of, if not, many of the books since over 30 years. The research, I've read much of the research, and it's confusing. That said, what kind of dietary guidelines based on your research do you recommend to prostate cancer patients?
Yeah. So in our prostate study, we focused on cooked tomatoes. So we recommend cooked tomatoes because the lycopene is more bioavailable when you cook it versus the raw tomato. And we tell people to add a little bit of olive oil, which also helps make it more bioavailable when they eat it or cook it. We also recommend cruciferous vegetables. There's a lot of detoxifying compounds in cruciferous vegetables. So I'm talking about things like broccoli, cauliflower, Brussels sprouts. We also recommend eating fish. Some people don't like fish, but if you do like fish, it's a good food for many different chronic diseases. For example, heart disease, now prostate cancer. So we recommend at least 1 to 2 servings of fish a week.
So break that down for us a little bit more, if you can. In other words, what kind of fish? Some are higher in mercury than others, farm raised versus wild type. What are we looking at?
Yeah, I focus on those that are high in omega-3s. I say salmon. Salmon's an easy one. Lots of people like salmon. There's other things like sardines and mackerel, which is, I think, a little harder to eat. But if you like that kind of fish, eat it.
Speak for yourself. Right.
But those are the types of fish that I would recommend to someone. Yeah.
As it relates to salmon, which tends to be lower in mercury, and sardines as well, so that's not an issue for those that are concerned about that. Do you know what's the lay of the land as it relates to farm raised or wild type? I know that wild type may be higher in omega-3 fatty acids, but some people are telling me, no, some farm raised salmon is done so well that, it's almost like wild. And I haven't verified that. So can you expand on that? Do you know anything about that?
Yeah, I haven't verified it either. We don't look at that in our studies. So we don't really have data on whether one is better than the other for this question on prostate cancer outcomes.
You've heard it many times before, I'm sure, right? Particularly in California, they're health conscious.
Yes.
All right. So we have cooked tomatoes, cruciferous vegetables, fish, maybe salmon, since that's what Dr. Kenfield likes. So if that's what she likes, and then, we all gotta like salmon. What are the other foods?
Yeah, I would recommend, so some of the foods to avoid, right? Red and processed meat, especially processed meat. So we tell our people in our studies, if you can, avoid it. If you can't, maybe 1 serving a week. Red meat, there's less consistency with red meat.
Processed meats, let's pause there for a second. Processed meats is your bacons, by the way, even the type of processed meat that you think is healthier because, I don't know, is less fat, but it's still processed, like turkey bacon is still processed meats, right? Hot dogs, all these things, cold cuts.
Yeah, cold cuts, hot dogs, bacon, anything that's been preserved by salting or smoking or curing or adding chemicals to it, we tell people to avoid if they can, or make it like a special treat if you can't cut it out completely.
Yeah, I always say when you go to a ball game, when I go to a ball game, probably the only time I have at least a regular hot dog, because we try to get grass-fed 100% beef hot dogs here. But when I go to a ball game with my son and we just have a hot dog, and I'll have a beer, he'll have a soda. The only time he really has a soda, one of the very few times I have a beer, and then Cracker Jacks. That's our thing, right? And so that's an exception, I think, so that you want to look at it. Yeah, you don't want to, and the thing that people need to understand is, and if you're listening, that one time of anything will not cause prostate cancer. It's the accumulation of consumption of some of these foods that may, within time cause it. So, the number one Dr. Geo food rule is do not ever eat anything with guilt.
Yeah, I'm big on moderation.
Yeah.
So, just be moderate about everything, except for fruits and vegetables.
Exactly.
Be the wild for that.
Yeah, right. Go nuts. Go nuts on fruits and vegetables. Speaking of nuts, where does that land in your category?
Nuts are good, actually. Healthy fat is good. It's been shown to be beneficial for prostate cancer outcomes. So these are things like olive oil once a day, a handful of nuts, avocado oil as well, peanut butter, almond butter, things like that. So that we have recommended that in our study. to increase your intake of healthy fat.
Oh.
On the flip side, decrease your intake of saturated fat.
Mm.
And there are a number of studies now that show that drinking whole milk is harmful for prostate cancer outcomes. And so
Compared
we
to
tell
skim
people,
milk?
compared to zero whole milk. So we're looking at, I mean, the cutoff was about four glasses a week versus zero.
Of any milk or whole milk?
Of whole milk.
Mm-hmm.
The data are super consistent for whole milk. So we tell people you can have lower fat milk.
Mm-hmm.
That seems to be okay, like 2% or skim.
Mm-hmm.
But or even plant milks, right? But if you can just cut whole milk out, that would probably be best for you.
So Dr. Geo, Dr. Kenfield, this is a common question. I just put a little bit of cream in my coffee once a day. The answer to that would be what?
Well, I wouldn't do that, but I don't think we haven't looked at that, right? We haven't looked at that dose. That seems to me a very small dose.
Mm-hmm.
So I wouldn't say, I don't think there's evidence to support avoiding that practice.
Mm-hmm.
If you still want to continue. There's so many other things you can do. So if you really want that cream in your coffee, I won't tell you to stop.
Yeah, that's pretty much my approach. And also it goes back to exercise. You can sort of get away with a little bit more when you're constantly moving, because what your body does with these things that you consume is different in a sedentary person versus a person that's constantly active. Do you think, and based on your research, that the issue with dairy is indeed the saturated fat, or is it, I don't know, some people say that some of the protein, some amino acids can induce the mTOR pathway and, can induce cancer? What are your thoughts on that?
There's no data on protein right now and prostate cancer outcomes. My view is it's probably the saturated fat.
Mm-hmm.
So that's why I would avoid it.
So as opposed to polyunsaturated or, monounsaturated fats, is literally the saturated fats. Yeah. So cancer is formed by some sort of signal that tells the cells, keep replicating, don't stop. So there's a signaling element to it from something. It could be from a hormone. It could be from something in the environment. Any idea, like, what would be the mechanism that the saturated fat, and I don't want to get into the carbons being with hydrogens, we need to get, but any idea what's actually happening there that it can signal a cell to keep replicating?
I have not looked at that. I'm more at the epi level. I'm not the basic scientist, chemist person. So I'm not sure.
Yeah, I'm curious. Maybe I'll do a deep dive in that, like I tend to do in some subject matter related to prostate cancer. All right, so let's get back to meats for a second. So processed meats, definitely, I would say any processed food probably is not the best thing. Whether it's processed carbohydrates or processed meats, not a great thing. Processed foods of any type. Back to meats. So my research indicates that red meat is not so much of a culprit in this scenario as it relates to prostate cancer, that it's more related to processed meats. And that research is very clear, much of that research coming from you and your team. The other potentially is cooking in high heat, when now you cause these carcinogens on the muscle of the meat, these hydrocyclic amines and PAH and things like that. Is that real? Should I feel guilty when I go to the next barbecue that I'm eating, a grilled piece of meat? Expand on that if you can, based on your research.
Yeah. So curing and smoking meat can lead to the formation of these cancer-causing chemicals. Also, cooking at high temps, so pan frying or grilling or barbecuing, can also produce these cancer-causing chemicals. I think, though, in moderation, as long as you're not doing this weekly, I don't see this as a major problem. So again, moderation. If you're going to go to that one-off barbecue, during the summer time, I would enjoy that.
Mm-hmm.
I wouldn't not eat the grilled meat one time because of this association. So I think in moderation, you're okay.
But the grilling definitely, and these pan frying, definitely there's something there. I mean, how strongly has it been? Obviously, we don't know causation, but how strongly has it been associated based on your research?
Yeah,
Like, for example, in comparison to processed meats, which is almost no brainer at
yeah,
this point.
yeah, we have not looked, our group has not looked at the types of cooking methods. We
Mhm,
just know we're basically trying to infer like what is it about meat or
mhm,
processed meat that is bad, right? And so we're just trying to understand, okay, well, it's probably the cooking process. It could be the part of the cooking process that is causing this increased risk. But very few like cohort studies have really asked about meat preparation. And so I think a lot of this is not from the large cohort studies that we're actually getting this information.
The other issue with these types of studies, which I'm very grateful for because it gives us guidance and guidelines. One of the issues is that so many variables. So when you look at most meat studies, typically meat eaters are not healthy people. They don't do healthy things. They don't exercise. They don't move. They typically are smokers. They typically, eat processed carbohydrates. When you look at research that looks at healthy meat eaters, vegetables primarily, the risk of any disease is low. What are your thoughts on that as it relates to prostate cancer? So let's say they eat meat with broccoli. My favorite,
Yeah.
eat meat and a cruciferous vegetable all the time. What would you, and let's just say it's not processed meats, it's regular, red meat, and it's, I don't know, cooked in I don't know, maybe in a pan sometimes, I don't know. But what are your thoughts there in terms of all the different variables in epidemiological studies?
Yeah, I mean, we talk a lot about the healthy plate.
Mhm.
And so I think a healthy plate is like half vegetables and some fruit, a quarter lean protein. So what is that? That could be fish, our salmon that we talked about. It could be skinless chicken or turkey. It could be potentially egg whites, some skim cheese, soy products, tofu, beans, lentils,
Mm.
things like that. And then the other part would be starchy carbs like sweet potatoes, squash, or whole grains for that last quarter of your plate. So I think it's okay to eat lean protein as part of a healthy diet if we're making a whole plate up, and then just making sure that half of your plate is that salad or those vegetables and
Yeah.
a little bit of fruit.
Yeah, don't tell me what you don't eat. Tell me what you eat. What's your diet? Well, I don't eat, this, that, or the other. I say, don't, no, 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 no. Tell me what you eat. Don't tell me what you don't eat. People like to focus on what they don't eat when you ask them such a question. Poultry, I think it is from your team and your research that I've started telling people, look, I got bad news for you. You could eat your chicken, but you got to take off the skin.
Yeah, yeah,
Like that's as painful to me as it is to you, but the evidence seems to be pretty clear. What's happening there? Is it that the skin, so fatty tissue tends to hold a lot of environmental toxins in our bodies and in any living
yeah,
animal?
yeah.
Is it the saturated fat? Is it all the above?
I
Why
mean,
is skin so bad?
yeah, I mean, it could have some saturated fat, but I think when we think about it, we think about grilling and having that skin on when you're barbecuing.
Yeah, yeah.
And so when we're talking, we've already talked about grilling and how that could be bad, causing cancer
Mhm.
compounds to form. And so removing the skin, which is touching the grill, removes that aspect, right, that we've been talking about. So I think grill it with the skin, remove it, and then eat the chicken is probably the best thing for you.
That sounds good. I'll take that. I'll take that. And again, the poison is in the dose because man, there are times where there's no way I'm taking the skin off, depending on who's cooking it and so forth, right? Some family members that got
Yeah.
different. Anything else with related in relation to food and the prostate 8 that we are missing in terms of what to eat and what not to eat?
Yeah, I guess the only other thing I would mention is that we don't recommend supplements unless your
Mhm,
doctor recommends them for you.
mhm. And is
So,
it more because you don't know or you don't know the risk versus the benefits? What's the deal?
well, we looked at selenium, which has been promoted as a thing that you want to take for your prostate in prior, decades. We looked at that in the health professionals follow-up study and saw that high dose selenium supplementation was not good. It
Yeah.
actually increased your risk of prostate cancer specific death. I think a lot of people have enough selenium from their diet, and so why add more? And so I think it's when you're like supplementing with these high dose supplements is when the problem occurs. I do think it's important that people get tested for different nutrients that they think they're not high in. not meeting, the average recommendation, and then potentially supplementing then. A lot of people are low in vitamin D, as you know. And so, but I still recommend getting your vitamin D tested to see your level tested to see if you are low, to see if you need to supplement. People that are vegan probably should be taking a B12 vitamin. But other than that, we say talk to your doctor first. Don't make your own decisions on your own.
And it depends what doctor you talk to, because if you're talking to this one, I take quite a few, and some of my patients take quite a few as well, because when we break down dietary supplements, yes, it's vitamins, it's minerals, and too much of a good thing is a bad thing. Zinc is that, for example. Some research suggests higher than 100 milligrams of zinc a day may actually increase the risk of prostate cancer. Meanwhile, zinc is the prostate mineral if you look at enough research, right? Like that is the mineral that everybody focuses on. But too much of a good thing is a bad thing. You should never get 100 milligrams of zinc a day from food or supplementation. So that's one. Folic acid is another, or too much. And if it's not folate, it's folic acid. There's a lot of research there. Selenium is very interesting because it kind of, so I had Eric Klein on, and we've become good friends. And he, and I said, look, I have some beef with you. I have some beef with you in the SELECT trial. Again, I don't want to go too deep into that, but the bottom of that story is that when I read the SELECT trial, we're talking about 20 years ago or a little bit less, the type of vitamin E that was used is not the type of vitamin E that was used in other research that indicated, hey, let's look into this a little further. In other words, they used what's called DL synthetic alpha tocopherol, which is synthetic, not mixed tocopherols, which is more natural, is what you would find in almonds or something. So mixed tocopherols is what you want if you're going to supplement with vitamin E. Selenium. In the 1996 JAMA trial that looked at selenium, showing that it reduced the risk based on people who took a supplementation, it used a food yeast, selenized yeast, as opposed to one element called selenomethionine, which is what they use in the SELECT trial. I said, Eric, why use the wrong, because this could have been pivotal. This could have been to really tell us, hey, it's okay. Like even mixed gamma tocopherol is not good, or, I wanted to know. And anyway, the bottom line is that they couldn't standardize the yeast. So they said, okay, which is the selenium that they use most of the time? Okay, selenomethionine with the DL alpha tocopherol, based on other studies, not numerous other studies, I recommended that mixed tocopherols, particularly with gamma tocopherol. So that's a little biochemistry that gets into the weeds, but I think those nuances are actually very important. Why? When you take something from nature and you I'm still with lycopene, all the research and everything. There, I say take it in tomatoes and tomato sauce.
Exactly.
There's other carotenoids in it that actually probably work synergistically. Don't hyper standardize anything from nature. Because
exactly
right.
So go for the whole foods. Don't
go for the whole foods.
Take supplements if you absolutely need them and your doctor recommends them, but go for the whole foods.
The other component of supplements, I guess it's just FYI, because people are listening to you and they say, well, Dr. Geo, you talk about certain supplements to take, not others. They got to say, who's right here? The other component is herbals, botanicals, which is something different. You can't really measure a deficiency or anything. That's trying to do something else. And there's some botanicals where I think like curcumin, right, is very good. Now, people you would say probably, hey, so eat more curry, add curry to all your stuff. No problem. I have no problems with that, actually, except that maybe your partner won't like to be around you if you take too much curry, but that is a way to go. Garlic and spices and all these things that actually, to me, have great anti-cancer properties. I think there are a lot of nuances in supplementation. I think we could all do a better job figuring that out and teaching about that, or studying it a little bit better, because I think they're here to stay. And to your point, most patients come to me, literally half of the desk that is full with supplements, and I think that some of them are actually harmful, and some of them can actually promote prostate cancer because they're over that threshold of 100 milligrams of zinc or something else like that. They're taking like 600 micrograms of selenium when you combine it all, and yes, that's a problem. But certainly in our conversation, and we talked about this, when we have to rank what's most important, supplementation is, should be last on the list, and everything else should come first, if nothing else.
Yeah. I agree.
Um, we've been on for over 50 minutes. I try to keep it within an hour. So last question would be, last thoughts from you. What's another takeaway that in your research as it relates to lifestyle, I don't know, deep breathing exercises, I don't know what else you're looking at, that you would say, look, this other thing, if they do this other thing, would also help people with prostate cancer? Is there anything else?
I mostly focus on exercise and diet.
Mhm.
So those are the things that and not smoking. So those are the things that I would recommend. We also talked a little bit in advance of sleep
Mhm.
and how sleep impacts diet and also probably whether or not you want to exercise the next day,
Right.
right?
Mhm.
So I think focusing on those three elements, your diet, your sleep, and your exercise, and if you smoke, to stop smoking are what I would recommend.
On a consistent basis, right?
Yeah.
Um, so there's no other magic fruit out there, a goji berry out there, something, there's no goji berry out there that
No,
if you eat 5 goji berries a day, your
no.
cancer will go away.
Hey, if
Nothing
you
like that.
exercise 20 minutes a day, the exercise is medicine. So
Oh no, I'm with you on that for sure.
I will sell that to the last day I live. So
And so for the rest of your career, I guess you're going to dive deeper into exercise and try to be more prescriptive. Is that the plan
yeah, I
with
think
lifestyle and exercise?
personalized medicine in terms
Yeah.
of lifestyle is really like understanding where the person's at, understanding what resources they have available to them, and how can we tailor a program for you. And so we know everyone comes and, everyone has different strategies, different barriers that they come in with.
Mhm.
Some may live alone, some may live with a partner. Like trying to tailor a program to meet who they are and where they're at is I think where the field is going.
Let me ask you one more question. Do you think, I mean, again, I am saying lifestyle medicine, A, is medicine, B, and I do think there's anti-cancer properties when the different elements work together synergistically with exercise, diet, and so forth. They work together in many ways, and there's some mechanisms out there, myokines that are released from the muscles that have anti-cancer properties, some studies show. Can we say, I mean, can I say that lifestyle medicine it does have because I have been, and I've been, and I've held back for 15 years or so, that is actually medicine. And I think there's anti-cancer benefits from lifestyle medicine that if you include other things that you've,
Oh yeah.
right?
I mean, I think every person who's diagnosed with cancer in general should get a lifestyle medicine program,
Yeah.
because there's something that they can do regardless of what cancer you're diagnosed with.
Yeah. And there's things in it, in the food, and, they works together, right? So you eat the food. What happens to the food? I mean, what happens to the food? There's a process, right? So you break
Right.
this down. There's different metabolites from the food. Many of those metabolites from what you eat may have anti-cancer properties, but if there's poor circulation, it's not going to get there. So then now, if you move your body, that helps with circulation, right? So now
Mhm.
it's more likely to get where it needs to get, and and that's actually more technical and more scientific mechanisms that I don't want to go into, but I think it's there. So good. I don't feel as bad because typically I am the prostate cancer lifestyle expert and they're not really questioning me, but I am questioning me. No one can question me more than I question myself. So I always want to make sure that I'm doing the right thing.
Yeah.
Dr. Stacy Kenfield, oh man, thank you so much. We're going to have you back in June because
Okay.
I need to know the outcome of that and my audience needs to know the outcome of that exercise study that you're in. Any
Wonderful.
last words, and how can people find you or your work?
Yeah. So we have a website.
Mhm.
Hopefully we can put it in the chat. It's UCSF Urology. Let me grab it for you.
Yeah. Yeah, I'll post it on the show notes and make sure we get that around for sure.
Yeah. So it's UCSF, urology.ucsf.edu,
And
forward
why don't
slash
you repeat it one more
lifestyle.
time, please?
Sure.
Hmm.
urology.ucsf.edu forward slash lifestyle forward slash resources. And you can
Beautiful.
find all of our diet and exercise guides as well as other resources there, mostly for men with prostate cancer. There are a few things for
Wonderful.
the general population, but there's a lot of great material there. including how to cook fish and use, buy, prepare, and cook these different foods that we're recommending for prostate cancer.
I love it. I love it. Thank you so much. Thank you again for the work you do. I mean it from the bottom of my heart. I would have been, honestly, if it's not for the work you do, and very few people that do the work you do, I would be kind of guessing a whole lot more than I am now. I can say that there's a sign because of you. For a while, I've said, look, I have a science-based approach to lifestyle medicine for prostate cancer. It really is due to your research. So I can't tell you how much I appreciate your work, and so I wish you continued success. And again, you're welcome to come on and share your research anytime you want.
Awesome. Thank you so much.
All right. Thank you, everyone, for watching this great episode. Excellent information, really science-based, folks. Look, science is important, and we cannot just kind of make up our own stories, though we sometimes want to. We need a scientific way that provides us with good guidelines, that really studies with people, not just, animal studies to get some idea of what to do, particularly with prostate cancer, because as you know, you can thrive after prostate cancer. Don't just survive, but thrive. And lifestyle medicine is the way to do that. So thanks a lot for tuning in. Until next time, this is Dr. Geo signing off. Much love. Thanks for tuning in to this week's episode of the Dr. Geo Podcast. You can watch all episodes of this podcast and much more by subscribing to my YouTube channel. If you love what you heard today, you can help by leaving a 5-star review of the podcast on Apple and Spotify, as each review helps us reach more men who are serious about improving their urological health and how to function better with age. And for the latest research and actionable takeaways in the world of men's health and integrative urology, sign up for my newsletter at drgeo.com. I'll see you next time.